আসসালামু আলাইকুম। কেমন আছেন আপনারা? আসলে আমি বোধহয় লাস্ট স্যাটারডে এসেছিলাম। আবার এই তো 1 উইক আম আপনার গ্যাপ ছিল। পরে আসলাম। আমার মনে হচ্ছে যে আমার মায়ের আলিঙ্গন ইভেন 1 উইকই আমার জন্য অনেক মনে হয় একটা বিরাট গ্যাপ। কারণ আপনাদেরকে আমি আসলে পাই না। মায়ের আলিঙ্গনে আসলে আপনাদেরকে দেখতে আপনাদের কথা শুনতে পাই। কথা শুনতে পাই না, এটা ভুল বললাম। কিন্তু আপনাদের সাথে একটা কানেক্ট ফিল করি ভিউয়ার্স। আম ভালো লাগে। তখন মনে হয় যে আপনারা যেখানেই আছেন, যেভাবে আছেন, আপনারা কিন্তু সবসময় আমার সাথে আছেন। এই মায়ের আলিঙ্গনের সাথে আছেন। আর আমাকে আপনারা এত উৎসাহ দিচ্ছেন, আমার তখন মনে হয় যে আমি আরো কিছু করি। আম নিজে একজন স্পেশাল নিডস চাইল্ড এর মা হওয়ার পরেও আপনাদের উৎসাহতে কিন্তু আমার আরো অনেক কিছু করতে ইচ্ছে করে। আ এবং যত অনুষ্ঠান আমরা করছি তত কিন্তু আমরা অনেক কিছু এক্সপেরিয়েন্স করছি। এজন্য আরো আমার উৎসাহটা বেড়ে যাচ্ছে। তো ভিউয়ার্স আপনারা জানেন যখনই আসি চেষ্টা করি কিছু আ নিয়ে আসার জন্য যেটা আমার মতো প্যারেন্টস এবং আমার বাচ্চার মতো যে স্পেশাল নিডস চিলড্রেন আছে তাদের জন্য একটু হেল্প হয়। এটাই আমাদের উদ্দেশ্য। মায়ের আলিঙ্গনের এটাই হচ্ছে ১ম উদ্দেশ্য যে কিছুটা যেন আমরা হেল্প করতে পারি। ইমোশনালি বলেন, কিছুটা একাডেমিক মানে যদি একটা থেরাপি সম্পর্কে জেনেও যদি সেটা প্রয়োগ করা হয় বাচ্চার উপরে যে প্যারেন্টসরা করেন, তাতেও মনে হয় যে আমার মায়ের আলিঙ্গনের এটা একটা সাকসেস যে আমি কিছুটা চেষ্টা করছি এবং কিছুটা করতে পারছি। তো ভিউয়ার্সরা চলুন আর কথা বাড়াই না। কারণ জানেন আমি আপনাদের সাথে যখন কথা বলা শুরু করি, অনেক কথা বলতে ইচ্ছা করে। আর আম আমার বন্ধুরা যারা সবসময় আছেন থাকবেন এবং দেখবেন আজকে আমাদের অনুষ্ঠানটা। আজকে আমরা উনাকে যে নিয়ে এসেছি উনি হচ্ছেন একজন অকুপেশনাল থেরাপিস্ট। উনি আমাদের ইন্ডিয়া থেকে আজকে এখানে আমাদের সাথে জয়েন করছেন। আর একটা জিনিস হচ্ছে যে আমি খুবই ক্ষমা চাচ্ছি। আম আজকে শোটা একটু হবে ইংলিশ স্পিকিং এ। ল্যাঙ্গুয়েজ যদি কোনো প্রবলেম থাকে প্লিজ আপনারা আমাকে আপনারা কমেন্ট করবেন। আমি সামারি করে দেওয়ার চেষ্টা করে দিব। আম আসলে আমি চেষ্টা করছি যে ভালো যারা তারা যেন আমাদের এই অনুষ্ঠানে এসে আপনাদেরকে কিছু শেখাতে পারেন, আমাকে কিছু শেখাতে পারেন। তাহলে চলুন সময় নষ্ট করি না। আজকে আমরা উনার সাথে পরিচয় হয়ে নিই। আমি চাইবো যে আমাদের অকুপেশনাল থেরাপি মানিশ সামনানি আমাদের সাথে জয়েন করুন। হ্যালো স্যার, হাউ আর ইউ?
Hello.
You must be really tired. You just had 2 hours training sessions, but you're still here. You're still here, and it's so lovely to see you. And I would say it's a privilege to have you here at Maralingon. I'm just going to just briefly tell you about the Maralingon. It is a platform where it's not just run by mom like me that who has a special needs child. I also have got very good friends. They don't have any special needs children, but they are doing from their heart. They want to do something good for our society. They want to help children like my son, and also the different abilities. As you know, that special needs children means it's a lot. It's not just only autism, and it has, goes into different categories. So I'm quite. I think it's very nice of them to give me this encouragement and allowing me to do something for our society. And when the persons like you come to this show, I feel really honored, and it gives me the encouragement, and it guides me. It guides me to take somewhere things that it just tells me that yeah, there's people out there who can help me to help others. And thank you again. And also your introduction is a huge. I would say that what you have done all these years and how you are helping and providing your academic side, and also that your experiences, and that you are kind of like continuing helping others. I was reading your, CV, and then I thought, oh, that's quite really, so much experience and so much knowledge you have and the degrees. But I'm still going to try to make it small. But I know it's not fair on you. But I think for the show is only 1.5 hour shows. So, viewers, this is Dr. Manish Samnani, if I'm saying it right. And
Yes.
he is a occupational therapist, and he has completed graduation in occupational therapist and on post-graduation in pediatric occupational therapist with gold medal. Think about this. And also is a clinical director of SOCH, serves on board as advisory and clinical mentor position for multiple organizations, and qualified in sensory integrations and neurodevelopmental therapy, and also trained in developmental assessment skills for Indian infants, যেটাকে short করে বলা হয় DASII. Am I right, sir? And also contributed as academic faculty for graduations and post-graduate occupational therapy students. He has presented papers in conference of All India Occupational Therapy Association and European Sensory Integrations Congress. He has developed and presented parents and professionals workshops about occupational therapy in autism, behavior and sensory integration in multiple cities across India and abroad. He organizes and contributes to professional development programs and short-term course in collaborations with university. He was with Autism Indian occupational therapy expert on the US-based Autism Live program, and also published 3 research papers in Irish Journal Occupational Therapy and also in Sensory Integrations International. Currently, he has been appointed as the Asia Regional Lead for International Normative Data Collection, projected by Thomas Jefferson University in ICE Sensory Integrations. He is the president of Haryana chapter for All India Occupational Therapist Association and has received National Award in Occupational Therapy for Professional Excellence in 2020. Wow. What an I think you have got so much. You have got so much to give us. Thank you. And Dr. Samnani, please say something. I think I'm just very amazed,
Thank you so much. I feel humbled about the lovely words that you have chosen to use for me for this whole program. In fact, I am also equally honored to be on this program. I know for sure that it is the parent community, especially in this field of children with developmental difficulties. The parent community actually has become and risen more and more stronger, more and more an instrument of change. So much so that even research articles are now talking about parents of children with special needs, with autism, with developmental difficulties. They are very well documenting what parents of children have to say for this field, how they are contributing, what is their perspectives. All these are now coming, not just these are happening as isolated things in the society like you are doing, but they are also very much a part of the formal academic and research work. I myself have studied certain literature which we call as a qualitative studies, where they have deliberately included parents' perspectives into the results of the research. They have interviewed parents, and uh, they have in fact informed all community of the world that the parent community is an important factor that has to be taken care, that has to be considered important whenever you have to do anything for the children, for children who have developmental difficulties. So having said that, what I want to say is I would like to acknowledge the efforts that you are doing. I would like to acknowledge the efforts that all other parents with you, all other parents who are other than you also. There are so many other parent communities, parent groups that are being run by parents. There are organizations being run by parents. It is not a simple thing where we should be able to appreciate and acknowledge that this field is one field where on one side it is considered as a highly technical and medical field, but on the other side, the parent has become a very important stakeholder
True.
in the overall development, advancement of this field. Parents have become the instrument of of change. Parents have become the instrument of revolution in this particular field. So, having said that, I acknowledge, appreciate, really thank you for taking the pain to do all these things that you are doing, not just of this particular program, but also of creating a whole big platform with you, with your efforts. And I really congratulate you that you would be able to take this forward in many, many more ways.
Thank you so much. And one thing I think I had mentioned this to you earlier, beginning of our conversations. I did say that even though people do know about the autism, people do know about the language and speech therapist, but sometimes I feel there's a gap in knowing what is really the occupational therapist is. People are getting confused. They are kind of like mixing with a few therapists together. They can't really separate them exactly what is the occupational therapist. As you know, that is a developed country. It's a developing country, and yeah, definitely we want to educate the parents first. If the parents don't know, I think it's going to be difficult to teach the children in an everyday daily basis. As you know that the children always with the parents, the most of the time with the parents. So if you don't know, even myself, if I don't know what is the occupational therapy is, how would I apply that to my child? How do I help my child? So if you just kind of like briefly tell the viewers, even to me and everyone who is watching here, so what is really the occupational therapist is therapy is?
Sure. I think that's a very important as well. So, occupational therapy is actually not being understood or not being very clearly understood by the society, because occupational therapy is in fact a very unique profession. It is unique because as a profession it works with not just children, but it works with an entire lifespan of people. I might be a pediatric occupational therapist working with children. However, occupational therapy profession is much, much bigger than that. Occupational therapy works with young age children, it works with adolescents, it works with adults, it works with not just children and other adults who have psychological, mental health, developmental issues, but it also works with children and adults if they have physical difficulties, orthopedic kind of difficulties, neurological difficulties, if they also have any kind of rehabilitation related difficulties. So the whole span of work or scope of work of occupational therapists is actually so wide that it is usually difficult to put it in few lines. The whole profession is not just dedicated for children, but is dedicated to the entire lifespan of a person's life.
Yeah.
And it is also not just affecting or impacting the mental health or mental health related kind of difficulties, but like I said, it also has other social, emotional, communicative, cognitive, physical dysfunctions also being treated by occupational therapy. In essence, if I talk of pediatric population or child population, then the pediatric occupational therapists are those people who are very well trained in the child development. Their knowledge of child development is unique also because they are the ones who are trained and knowledgeable about various functional aspects of a child's life.
Okay.
When I say functional aspect, I mean what is the typical development or normal, so-called normal or usual development of a child in terms of their any day-to-day activity, be it be toileting, be it be dressing self, be it be handwriting, be it be eating self, be it be labeling or reading. All these aspects are called as functional aspects of a child. Whenever you have a child in front of you, whatever activities the child does from morning till night that he sleeps, be it be play, be it be socialization, all those activities are called as functional activities. An occupational therapist is somebody who is knowledgeable in terms of the typical development and is also competent to work with this child who has some lags or delays in the development. First, by identifying the delay or lag, then by documenting the lag, and then by training the child and the parent in the particular area of development from his own knowledge of functional difficulties in order to treat the functional difficulty, in order to overcome the functional difficulties permanently also in lot of cases.
থ্যাংক ইউ সো মাচ। ভিউয়ার্স, আপনারা আসলে বুঝতে পারলেন যে আমাদের অকুপেশনাল থেরাপি সম্পর্কে sorry sir, I'm not translating, but I'm just communicating with my viewers. If there is any Bengali spoken, most of the viewers are Bengali spoken here, as you know. This run in Bangladesh, but I'm just trying to tell them that what is the occupational therapy is. So viewers, আপনারা শুনতে পাচ্ছেন যে শুনলেন যে আমাদের ডক্টর সামনানির কাছ থেকে যে আসলে অকুপেশনাল থেরাপিটা আসলে আমাদের যে এভরিডে লাইফের সাথে আমাদের অনেক ইনভলভমেন্ট হতে হয়। আমি নিজে একজন প্যারেন্টস মা হয়ে আমি যেটা দেখেছি যে ইট ইজ সো ইম্পর্টেন্ট যে এভরিথিং যখন আমরা আমাদের যে ডেইলি বেসিসে আমরা নিজেরাও কিন্তু আপনারা জানেন যে ওয়েক আপ ফ্রম দ্য মর্নিং থেকে আমরা যখন উঠি সেখান থেকে যে আমরা ঘুমাতে পর্যন্ত যাই, আমাদের যে এভরিডে যে ডেইলির যে কাজগুলো করতে হয়, আমাদের যে ব্রেন ফাংশন, আমাদের যে সবকিছু এভরিথিং কিন্তু আসলে আমাদের এই অকুপেশনাল থেরাপির সাথে ইনভলভমেন্ট। সো আমি আবার বলছি ভিউয়ার্সদের কাছে যে আপনারা যদি কোনো ব্যাপারে আপনাদের আন্ডারস্ট্যান্ডিং এর একটু কোনো অসুবিধা থাকে, প্লিজ আপনারা কমেন্ট করবেন। আমি চাই যে আপনারা যেন আজকে শো থেকে কিছু শিখুন। আর ল্যাঙ্গুয়েজের ব্যারিয়ারের জন্য যদি আপনারা সেটা না ক্যাচ করতে পারেন, এটা আমার জন্য একটা ব্যর্থতা হবে। ইভেন ডক্টর সামনানি অনেক কাজের মাঝখানে আজকে আমাদের এই অনুষ্ঠানে জয়েন করেছেন। সো প্লিজ ডু leave your comment. Thank you. So Dr. Samnani, I'm going to ask you another question is about the sensory integration. As you know, this is different. This is so much different. And of course, I'm going to ask you after that, once you have, I'm going to kind of like give us a brief idea so what sensory integration is and how does it work with the occupational therapy, how this works together.
Sure. So sensory integration is one of the approaches, theories, treatments that come under pediatric occupational therapy. Sensory integration is a big field in itself. It is a big field because this field was first kind of designed, theorized, postulated by an occupational therapist in 1960s. Jean Ayers, who has a birth centenary year, 2020 is her birth centenary year, was a person who was trained in academics, was trained in neurology, and trained in occupational therapy. Now, combining the 2 or 3 fields, she was a visionary who saw that the child's behavior, any of the behaviors that you talk about, are actually the mirror of the child's brain. Meaning thereby that if your brain has some sensory dysfunction, something that is not going very integrated or coordinated way, you could say, within your brain, then the same will be expressed in the child through the child's behavior. What we are supposed to do in sensory integration is, instead of looking at the child's behavior as negative or problematic or as something that should be corrected, should be fixed, what we try to do in sensory integration is try to look at the behavior as nothing but a connection with the brain. Try to read the behavior to understand what the brain might be undergoing, because you can't see the brain. You can see the behavior. When you see the behavior, try and analyze, and it requires a lot of intensive training to do that. To be able to do that, it requires intensive training to say, okay, if these are the multiple behaviors that I see in my child, what does it mean? What is it that is going on in my child's brain as something that is not so usual, something that is not so in line with the usual development of the sensory systems. Engineers also theorize that the sensory systems are the basis of all higher order thinking and learning. Meaning thereby, what she said was that the basic senses, be it be touch, be it be movement, be it be your sensation of joints and muscles, are something that needs to be integrated initially itself, over which your other senses, like my ability to see things, my ability to hear, my ability to think, my ability to learn, is all dependent on. Uh, Let me give you an example. When when children are not yet born, when they are in utero, they are already subjected to a lot of sensation. They are in a sack of fluid in which they keep bouncing, moving, swimming, you could say, or moving their limbs, is something that they are already subjected to, or they are already experiencing it. Now, because these things are happening even before birth, these are the things which will have a huge impact on the child's ultimate brain development as well. So what happens is, when children are newborn child gets calmed down, gets soothed, gets consoled, when you touch them on their back, when you tap them, when you bounce them, when you move with them. And why does this happen is because they are already integrating those senses much better than their sense of hearing. Suppose you tell a child, okay, be quiet, don't cry, that doesn't work much. But if you bounce a child, it works fantastically. So by that thing, what I mean to say is that certain sensory systems in our body are actually developing much before than your other senses. They might be present, they are physically okay, but their working, their functionality develops much later than your ability, or then your ability of the brain to assess and process some basic sensations, which include movement, it includes touch, and it includes your muscles and the joint sensation. So when a mother holds a child in her lap close to her body, she's already giving touch sensation to the child. She's already giving movement sensation. She's already giving the joint and muscle sensation, because she's gripping the child nicely, closely. What that means is these sensations become very important for the child before birth and immediately after birth and progressively. But essentially, these are proximal senses. Proximal means something that comes before the other distal senses, which are like my ability to follow instruction, my ability to focus on a given task, my ability to hear an instruction and take an appropriate action, my ability to behave properly, my ability to talk. All those functions are actually coming later, whereas the basic sensory functions come earlier to us, to all of us, not just children who have developmental difficulties, but to all of us, those sensations come earlier. She also said that if your brain has these changes, any of the developmental difficulties, what that development difficulties essentially means is that your sensory systems that are supposed to be there, that are supposed to coordinate with each other, somehow do not coordinate very well. That is what you are calling as developmental delay. Because what is development delay otherwise at the brain level? What is happening? If you do a CT scan and MRI, you don't find anything. Most of the children, there are children who you find findings, but there are a huge number of children where you do not find anything, even if you do the scans. And why you do not find those things in the scan is the sensory systems, the sensory processing, the sensory information to and fro is not something that is visible in the scan, but is very much a fact, but is very much a truth that is happening inside, because research has otherwise proven it. They have shown that it is the primary thing that can lead to all other functions that we talk about. Everyday functioning, behavior, communication, socialization, ability to bond with others, ability to even do physical actions, holding a spoon, holding a pencil, eating self. All these functions are actually very dependent and very impacted by your proximal senses. And if something is wrong there, we need to fix it at that level. We need to, the fix it might be a simplified version of it, but you need to facilitate those sensory systems. You need to empower those sensory systems. You need to make those sensory systems good enough that they support your other positive and higher order abilities like talking to someone, speech, communication, behavior. All those get empowered and facilitated once you facilitate the foundation. And the foundation is the sensory systems.
Definitely, it's very important. Even when I was listening to you, I feel like that you know how important that sensory system is. If it does not function properly, like you said, that it delay the whole system. So, and how can you, like in an early age, when the children are like 1 year or quite early age, how can I find out from that they have these sensory issues, like they have this kind of problem? How can you, as a parents, how can you find identify that problem?
Sure. Now, the earliest signs of sensory come from two major things. One is you need to see their what we call as a little sensory motor functioning. When you say motor, it basically means physical. Now, if a child has a delay in his or her motor functions, say ability to sit, ability to walk, ability to crawl, ability to roll, despite having good physical, otherwise apparently good physical, as a medical part, your body is fine. Your doctor says your body is absolutely okay, your muscles are okay, your body parts are okay, the scans are okay. But even then, you are facing difficulties in age appropriate milestones. Say head control should come by 3 to 4 months of age. Rolling should come by 6 months of age. Crawling should come 8 months of age. Standing walking should come 10 to 12 months of age. Sitting should come somewhere between 6 to 8 months of age. So, these gross motor milestones, if they are getting impacted, if they are slowing down, if they are not appearing on time, you should think about sensory rather than thinking about physical. Because physically you have ruled out, physically you have screened out. You have ruled out that fact that muscle, the strength of it, the sensation of the muscle is all good. Muscles are primarily controlled by the neurological system. If your neurological status is okay, if there is no apparent gross physical problem, but still you are having delay in physical functions, then you will start thinking about sensory. The second aspect is and may not be separately, but connected to this is, remember that your oral motor function is also a part of the sensory or the sensory motor, meaning thereby that if the child does not latch for feeding, the child does not take feed very well, the child does not know how to use his mouth in a, we call it the suck swallow breathe way. It's a coordination. You have to suck milk, you have to swallow milk, and you have to also be okay with the breathing. Remember that when you are swallowing, the breathing stops temporarily, which means your suck swallow breathe should go in such a coordinated way that when breathing is happening, swallowing is not happening. When swallowing is happening, breathing is not happening. During feeding, in a newborn child, if you feel that the oral motor and suck swallow breathe is not very good, somehow there is a problem there, somehow it's just not happening, then you should start thinking of why would there be an issue with the suck swallow breathe functioning of the child's feeding, which will typically, again, given the fact that I'm assuming there's no physical issues by birth identified by the medical doctor. If there are no physical issues identified, then the oral motor suck swallow breathe should indicate some sensory or potential sensory issue later on. The second thing about sensory is that it affects your ability to regulate yourself. What do I mean by that is, children, newborns, are cranky or they are crying, but you have to see that how easy or difficult it is to console them, to bring them back to the usual calming down state. Now, if you find a child who cannot be consoled easily, where there is a huge difficulty with making the child calm down, on making the child getting into a state of rest and sleep, be it be very newborn age or be it be a later age, that shows a neurological regulation is not happening. And again, the one of the primary reasons that you have for children not being regulated, if you understand the term regulated, it just means to bring them back to a normal state of mind, bring them back to a calm down state of mind by certain ways, whatever the ways are. We all know how young children are. We all know how newborns are. They are frequently, cranky and irritable and everything. But if you find a child who has huge difficulties in, and the amount of energy and effort that is required from the parents, from the caregivers, is huge, is so much that it starts affecting the parent and the caregiver, then you should start thinking about sensory. So regulation is one, sensory motor is one. At certain age, may not be in a newborn, but at certain age, you will also find difficulties in their sensitivities. Now, for example, an early sign is, suppose I make the young age child tilt on the bed because I want to change the diaper. Now I see that if he was sitting and all, he was fine, but whenever I am tilting him back onto the bed for changing the diaper, he cries frantically. He cries extremely. And it is happening as a regular pattern whenever I am doing it. It basically means that there is a sensation here in the inner ears that's called vestibular. The moment I tilt someone like this, the moment I tilt someone, it gets triggered. If that triggering should not be uncomfortable to you ideally, usually, but if that tilting happens and it is absolutely uncomfortable to you, for the child, for the toddler, you should start thinking of child being sensitive. And if the child is sensitive, which can happen with the cloth textures later on, or sounds, or taste, flavors, or the child is not very comfortable with the touch, the mother or the caregiver wants to take the child close to the body but the child reacts to it. Every time the child is taken close to the body, child might mostly be okay with mom's touch, but is extremely upset and uncomfortable with touch in general, then you should start thinking about sensitivities. And where does those sensitivities come from? These sensitivities come from the sensory integration kind of a functioning, and probably is a symptom of further future potential sensory difficulties. So sensory motor function, physical aspect, second is regulation aspect, and the third is sensitivity aspect.
থ্যাংক ইউ স্যার। আপনারা ভিউয়ার্সরা আসলে ডক্টর সামনানের কাছ থেকে যেটা আমরা এতক্ষণ শুনে বুঝতে পারলাম যে অনেক আর্লি এজ থেকে আমরা কিন্তু অনেক কিছু আসলে বাচ্চার ব্যবহার থেকে, বাচ্চার যে সেন্সিটিভিটি, আমরা কিন্তু আসলে সেই সিমটমস গুলো দেখা যায়। কিন্তু অনেকে হয় কি, আমরা হয়তো আমরা প্রথম প্যারেন্টস হয়েছি, হয়তো এটা আমাদের প্রথম বাচ্চা, কিংবা আমরা অনেক কিছু আসলে ওভারলুক করি, কিন্তু সিমটমস গুলো আসলে দেখা যায়। এবং আপনারা যদি মনে করেন যে কোনো একটা ব্যাপারে একটা বাচ্চা ঠিক অন্য আরেকটা বাচ্চার মতন হয়তো বিহেভিয়ার করছে না, বা যেটা করা উচিত, যেমন আপনার যেটা শুনলেন, ইভেন একটা ন্যাপি চেঞ্জ করতে গিয়েও যদি একটা বাচ্চা যদি কোনো ব্যাপারে মানে খুব আনকমফোর্টেবল থাকে, এবং একটা বাচ্চা যদি সারাক্ষণ কেঁদে যাচ্ছে, কিংবা আপনি একটা বাচ্চাকে হোল্ড করার সময় যদি দেখেন যে বাচ্চাটা ঠিক মতো আসলে কমফোর্ট ফিল করছে না। একটা বাচ্চা কিন্তু একটা নর্মাল হলে কিন্তু একটা বাচ্চা প্যারেন্টসে বা কারোর কমফোর্টে কিন্তু অনেক কিছু মানে ফিল করে, কিন্তু তাদের কোনো একটা ব্যাপারে হয়তো সেখানে তাদের যে প্রবলেমটা হচ্ছে, তো এই জিনিসগুলো কিন্তু আসলে বোঝা যায়, অনেক ছোট থেকে বোঝা যায়। যেমন আমরা খাবারটাকে নিয়ে অনেক কমপ্লেন করি, তারপরে অনেক সময় আছে বাচ্চাদের কাপড় চোপড় পরানোর সময় কিন্তু, যেটা স্যার মেনশন করলেন যে টেক্সচার, যে বাচ্চা একটা যে ফ্যাব্রিক্স, সেটাও কিন্তু আসলে আমরা অনেক সময় খেয়াল করি না। আমরা কিন্তু জোর করে বাচ্চাটাকে আমরা সারাক্ষণ কমপ্লেন করছি, বাচ্চাটা কেন কাঁদছে কেন কাঁদছে, আমরা কিন্তু আসলে বটমে যাচ্ছি না। আমরা কিন্তু চিন্তা করে বের করার চেষ্টা করছি না যে বাচ্চাটাকে কোন জিনিসটা আসলে কমফোর্ট দিচ্ছে না। সো এই জিনিসগুলো আপনারা যদি প্রথম থেকেই আপনারা মনে করেন যে ইটস নট বিয়ারেবল, যেটা আপনারা মনে করছেন যে না একটু বেশি মাত্রায় চলে গেছে, প্লিজ ডু কনসাল্ট। আপনারা যত আর্লি এজে আপনারা এই জিনিসগুলো আইডেন্টিফাই করতে পারবেন, তত কিন্তু আপনি থেরাপিটাও আপনি স্টার্ট করতে পারবেন। আপনি মানে যারা এখানে স্পেশালাইজড আছেন তাদের কাছ থেকে আপনারা এই আইডিয়া গুলো নিয়ে কি করে বাচ্চাকে হেল্প করা যায়, এটা কিন্তু আসলে অ্যাকসেপ্টেন্সটা, যেটা হয়তো স্যার নিজেও জানেন যে অ্যাকসেপ্টেন্স, আমরা কিন্তু অনেক সময় মনে করি যে না না কিছু হয়নি, এই জিনিসগুলো কিন্তু আমরা ওভারলুক আমাদের করে যাই। কিন্তু আমাদেরকে আসলে ছোট থেকে এই জিনিসগুলো যদি আমাদের কষ্ট দিয়ে থাকে, আমাদের আসলে অ্যাজ এ প্যারেন্টস বাচ্চার ভালোর জন্য আমাদের সামনে আসা উচিত, আমাদের গাইডেন্স নেওয়া উচিত যারা স্পেশালাইজড আছেন তাদের কাছ থেকে। So আমাদের এখানে কিছু viewers there, sir. I'm just going to read some of the comments, if you allow me. I can see that people are watching you, and I'm sure they are really, with these big comments, you know that I'm sure they are really enjoying your, what you are sharing with them. So I've got this Rajibul Islam here. What he has said that is the occupational therapy must be very specific to each individual, and this is very expensive for many parents. So is it possible the parents can take a course for their child so that they can work as a therapist? This is a fantastic question, comments from Rajibul Islam. We live in a developed country, like I live in the UK, and we get lots of things free. It's provided by the education department, but unfortunately, like Bangladesh, India, we have to pay for the therapist, and they can be quite expensive. So like you said that this is really good, that how we can educate the parents, that if the parents knows how to do things every day, then it helps the children. So if you come for more comments, if I see them on the screen, Anik Jaman also said, thank you, doctor. And also Israt Arakorim said that definitely, yes, it's possible. And many are learning and giving after learning certain therapy as well. But there are a few only need expert to get proper result, only depends on parents' ability of learning. Thank you, Istrat, Arakorim. And also Tania Ahmed said that how do you assess a patient's condition and track their progress? This is so important. This is absolutely important. Something Sir could answer later. And also, if I can see, Shaznamna has said that Manish Samnani, sir, great explanation. Thanks a lot. And Shujana Kafilipi said, sir, my 16-year-old child hits her and hits himself. Is it sensory issue? I've got few questions from also the Susanna. As you can see, I've got so many questions here to ask you. I thought I'd do that before, you know, just read these comments, but I think it's time now, as Susan already started asking. Susan, I have got some of your questions. If you please do correct me if I said it, if it's a right age 16. Susanna, if you're there, if you're watching the show, please do say this is your son. Is a right age 16. She has provided few questions earlier because yes, she is. Okay. So Raid is a hyperactive child, and so sorry, this is I have to translate it because she's written in Bengali. And what he does, যার কারণে ওকে নিয়ে, so because he's so hyper, it's difficult to do things with him. And what he does, he right কিছু so he can't chew. So he finds any food that he can't chew. So what he has used is a straw. So he I don't know, is it even the food? How can you really has the food used by straw? So this is something I need to ask the mom, because I'm not sure that is it the food is mashed. So how can you do that? If Susanna, if you're watching, please do answer this. Are you talking about the straw is like a milk, like a drinks, or are you talking about the food you are mashing them and then you are like kind of like process into a liquid and then you do it with a straw? And also what she said that the child can't gargle. So that another something mom has been trying for a long time. She did mention that earlier, that he can't gargle. So whatever he takes in his mouth, he does to pick things up and he put them in the mouth. So that those are like very dirty stuff. He does put them out. So mom wants them to bring it out. So mom is trying to teach him to take the water and do the gargle and bring the water out. But some reason it's finding it hard to do that. And also he said that he does hit other people, and also he does pinch them all the time, and that's something he does, that he slap people. And also what he started now recently, he is kicking, and he's using his feet. And they are trying to give him the dry food, but he is not showing any interest of eating the rice on his own. So the mom, like you can see, these are the very common stuff for the autisms and for the special learning disabilities and the hyperactivities. But mom has been trying so hard. Mom is trying so hard to teach him, but some reason things are getting a little bit harder for far harder for him. So could you please, if you're would you like me to repeat this, or you are okay with Dr. Samnani?
Yeah, I'm okay. I'm okay.
So if you answer.
Yeah, sure. One of the primary things that I would like to start with as a solution is that when you have a child who has multiple difficulties, like there are certain difficulties which are related to skill, like gargling is a skill, whereas there are certain difficulties which are relating to what we call as an adaptive behavior, like hitting others. We understand that at 16 years of age, it is a difficulty with being adaptive with others or behaving in a certain way that is socially, emotionally acceptable and universal. So on one side, we have a skill related kind of difficulties. On other side, we have a little adaptive behavior kind of difficulties. On third, we also have feeding related difficulties. Now, whenever you have a child who has multiple difficulties at an older age, we do need to see it a little more closely. Why? Because what the child might be undergoing at this age is also about his adolescence. Because he is an adolescent, certain things change or transition in us. It is known fact in research that adolescents, teenagers are relatively more aggressive because of hormonal changes. So there is nothing about, maybe, mother is doing whatever she is doing best. The child also is not really deteriorating or something, but it's an important part of the process. Whether you call it important or not, but it's a part of the process, that it is known that with hormonal changes, you do have aggression coming in. Now, whenever you have changes in the physiology, like digestive system, hormones is endocrine system, you'll have to work through it. When you say work through it, what does it mean is, it doesn't have a one pinpoint treatment. It has little bit of awareness, understanding part to it, because if as a mother, I am not able to understand it as hormonal, I'm able to understand it as only and only as negative behavior. How do I control myself? How do I create the positivity in the interaction with the child is a bigger question. Then what should I exactly do with this child? So whenever we assess children, and in this case also, we would need a little more closer interaction with the child and assessment to understand which aspect of it is sensory, which aspect of it is hormonal, which aspect of it is behavioral, and which aspect is very skill based. Hypothetically, I would assume that gargling is a little skill based thing, is something that the skill has not come. And the mother can try that the step one of every activity is to kind of simplify it, take one step back. For example, if a child holds, if a child does not hold water in the mouth, how does he gargle? Because the moment you give him water, he drinks it. If he doesn't hold it, if he doesn't hold water in his mouth, even for 1 second or 5 seconds, he's not going to gargle it, because gargling is the step two, right? Gargling is step two of holding the water in the mouth, which means that I need to see, and mother needs to see, whether the child can actually hold water in the mouth before gargling, before teaching gargling, before even attempting. If he cannot hold water in the mouth, it means that I have to first work on that itself. And how do I work on that? I can work by giving the child a demo on myself. I'm assuming I'm a parent or a mother. I hold the water, and then I tell the child to hold water, like an imitation. I give the demo. I show the water being filled in. I show that the cheek and face has changed in the mirror. And then I tell the child, now you do something and make sure that your face also looks like that. Looks a little puffy, looks a little filled up, which is filled up by water. So there could be imitation, there could be a visual demo given. And if a child is not ready, if a child is not ready to hold it in the mouth, even with that, what you should be teaching before gargling is that the child should simply take a sip of water and bend down, open the mouth so that the water flows out. So what you will do in that activity is, you will actually have the child near a sink, near a wash basin. You will already make the child bend down and then give him sip of water, and not the other way around. Because what happens is, some of the parents say that the moment you give him water, he drinks it. So there's no time to tell him to bend down, right? So what do we do? That there is, we do a tact. The tact is that we make him bend down over the sink, then give him water. We also take water before giving it to him, and we give a demo of how the water is flowing out. whether it is flowing out on my cheek, whether it is on my chin, whether it is flowing out on my clothes, or whether it is flowing out on the sink, or everything is acceptable. Because at the moment we are not teaching gargling. What we are teaching is, don't take water inside. There is a step called as outside also. And you are trying to teach him non-verbally. So you are teaching non-verbally by either demonstrating or also giving him the positioning so that he's already ready. The gravity is already pulling the water out. You are giving him and you are asking him to open. Give him and open the mouth so that the water just trickles down. Trickles down. What that does is, it gives the child an experience of water coming out of the mouth rather inside the taking in. There has to be coming out. Now, when you do that consistently, you can actually train the child to actually throw the water out. This is not throwing. At the moment, it's only dropping. Dropping will then lead to the motor planning, and then motor planning will then lead to teaching him throwing, like throwing the water out. Yeah. So you have to go graded in all the activities, and that is also an occupational therapy principle, that all the activities or skills that are to be taught has to be broken down into steps. Number one, which is called as activity analysis. Number two, take one step at a time. Number three, make the activity graded. Don't go for difficult part first. So gargling, throwing the water out is a difficult part. First go for the easy step, practice it again and again, then go to the difficult step. So apart from the skill based things, the other things that you have talked about, we need to definitely see. The feeding issue, of course, is a skill based thing. The child might have oral sensory issues. We will have to again do a close interaction. When you say oral sensory, it's again a very big area in itself. Under oral sensory also, there are so many things that come in. There could be behavioral issue also. A lot of times I have seen that the therapist, with some kind of positive, you could say positive efforts, is able to feed the child in my center better than the parent is able to, because the child takes the parent a little for granted. They show a behavior or tantrum not because they are deliberately trying to throw a tantrum, but if there is a hesitancy, if there's a barrier, if there is something that they can overcome by themselves, they will not try it. Everybody has sensory issues. I also don't like all the vegetables. You also would not be liking all the vegetables in the world. There are certain things which you will not like. With our children, what is happening is, the repertoire or the list of things not being liked is a huge one. And what we can start off is that when there is a third person input, and I mean in a positive way, I don't mean in a forcing way, strict way, I don't mean that. But what I have seen with feeding in my center is, apart from the specific typical sensory issues which need to be evaluated one on one, they can't be evaluated in this program. But beyond the specific typical technical sensory issues of the mouth, what also works with children is to give them a sense of control over the situation, and in a way telling them, you can do this. It's not that difficult. You can tolerate. If I don't like something, one particular day, if is given to me a little bit, small amount, little bit of positive coercion, I might take it. That might break the barrier. If it is a behavioral barrier, if it is an oral sensory behavior, of course, it does not happen like that. But what I'm assuming is, if it is a behavioral barrier, introduce a person that has the right attitude, which means neither the person is too strict and forcing, and it's kind of a war between the child and the person. However, the person has a positive insisting attitude towards the child, and he is able to manage the child beyond the difficulties that the child is facing. A lot of times I have seen the barrier of behaviorally not eating food does break down.
Thank you, Dr. Samnani. Also, I've got আশা করছি সুজানা কাফি আপনি এই জিনিসগুলো আসলে ট্রাই করবেন। ডক্টর সামনানি অনেক ইজি ভাবে উনি আসলে এক্সপ্লেন করলেন। আমি যেটা আমার নিজের ছেলের সাথেও করি যে আমার ছেলে কিন্তু 6 ফুট লম্বা এবং আমি আমার ছেলেকে মাথাটা নিচু করেই ওর মুখে পানিটা আমি দিই কারণ এখনো মানে ইজি ভাবে ও শিখে গেছে বাট আমি কিন্তু ওইভাবে স্টার্ট করেছিলাম কারণ আমি দেখেছিলাম যে ও পানিটা দেওয়ার সাথে সাথে খেয়ে ফেলতো তো আমি না সিঙ্কের কাছে মানে বেসিনের কাছে ওর মাথাটা মানে নিচু করে রাখতাম তো তখন আর কোনো উপায় ছিল না ওটা মানে গিলে ফেলার তো আশা করছি আপনি এই জিনিসগুলো আসলে ট্রাই করবেন বাসায় আর আমাদের তো ডক্টর সামনানি আছেনই আপনাদের যদি কোনো কোশ্চেন লাগে আমরা অবশ্যই ওনাকে কোশ্চেন করে পাঠাবো এখানে অনেক কিছু কোশ্চেন এসছে কিন্তু আমি এখানে আরেকটা মানে আরেকজন মা আমাকে কিছু কোশ্চেন পাঠিয়েছেন তার বাচ্চার সম্পর্কে আমি একটু she has written in Bengali so I have to translate are you okay Dr. Samrani so it just take a little
Sure.
bit time so
Sure,
what
sure.
she has said that it's so this child is 7 years 4 months he has got ADHD and the child is so he likes watching he likes to play with a mobile phone and
Okay.
he also listen the music but the problem with the music is he will rewind back to the same point so and I think this is quite typical because my son does the same thing he will rewind back the same sound same beat and so and also what she says um and also said when he wakes up, he doesn't want to brush his teeth, and he will not watch the TV like straight away, like his head will not be straight. So what he does is like he will be like doing it this way. So he will try to turn his head the other way and then watch TV. And so that's the way he watch TV, and also he cover his ears as you can see that probably the sound he doesn't like the sound so when he's in when he's outside he always cover his ears because he can't take the sound from the CNG he can't take the sound from the from all that the sound like coming on the road and also when the mom or anyone who will be trying to lie down next to this child so what he does he put his finger in that person's eye so he plays with them he tried to really do it quite hard and he will be pinching again as that he does pinch them and also suddenly from nowhere he's going to start making noise so and so how so this is something she wants to know that how she can help this child
Sure. Again, I would like to first divide the lot of problems into two categories. Now, one of the few problems like closing the ears, repeating the same song again and again. Now, there are certain behaviors or features of children which are very characteristic of the very diagnosis of the very difficulty that they have. It's a core difficulty. Unless those things are creating a functional problem to you, you should be able to be okay with it. What do I mean by that is, suppose he's closing the ears. Whenever there is a sound, he's closing the ears. I think he's doing something very adaptively. Adaptively means what am I supposed to do if I hear a sound? I'm supposed to close my ears. It is possible that I am more sensitive than you. It is possible that you are able to, tolerate the sound without closing your ears. And I cannot tolerate that sound without closing my ears because I want to reduce that sound to come to me. Children with developmental difficulties and autism have huge sensitivities which are part of them, which are part of their life, which are part of their being. If I am myself, I have certain sensitivities. All of us have. Unless and until that sensitivity is a problem in the sense it's a problem because it is creating a trouble to others, which I assume that I am closing my own ear, then it is not a problem to somebody else. Or the child is closing the ears throughout the day, for example. He's closing the ears so much throughout the day that all his other daily living activities, learning activities are getting impacted because the child's hands are not free. The child's hands are busy. If these are not there, if these are not true, then you should be able to be okay with it, even with the listening of the same song, I would say. If listening of the same song is being done throughout the day, is being done because in a way that I will not eat food, I will not study, I will not do sports, I will not do OT, I will not do this, I will only listen to the same song again and again throughout the day, I would then call it a functional problem. Or I will call it that this is creating an interference with the functional activity. However, remember that children with developmental difficulties would have something that's a little pervasive. Pervasive means it kind of stays with them. This is how they are. We all have people around us where we know about their certain aspects, behaviors, in our family members also, in our old age people also, our grandparents also. We know that there are certain things that they will do it no matter how much you tell them not to do it, or you might find it problematic. They will not mind it, they will still do it. So it is very important. What I'm trying to say is, I'm not saying that any child who's doing this should not be done anything. You have to evaluate as a family. As a family, please evaluate, is this something that is troubling others? I mean, disrupting others? I can understand about the finger poking somebody's eyes. I can definitely agree there. That is interfering, interrupting, unsafe for the other person. I would assume that if I am closing my own ears, I'm still okay. I'm not troubling somebody. Song listening also. If I am not troubling anyone, if I'm not throwing the remote away and telling that I would like to have my song at any cost, if I am not that extreme, then there would always be certain characteristics of children which we have to kind of live with it. They also are living with it, and we also need to kind of live with it and accept it. Again, this is hypothetical for me. I don't know at the moment these behaviors, how intense they are, or how difficulty they are creating to others or to his own learning. However, what I want to say is, if you think that just because it should not be there, just because my other or any other, whatever typical children you have seen, they don't do it, they don't do this, but my child is doing it. If that is so you have to evaluate if that is there in your back of your mind. If that is there in the back of your mind, then we have to work on ourselves as a parent and not on the child. And we have to work on acceptance, and we have to work on understanding autism, and we have to work on assuming that this is a part of their being. And there will always be certain behaviors with all children very uniquely, which is part of their being. The second aspect, like the parent said, that the child is 7 year old, and if the parent is worried about that the child does not get up and go for brushing, let me tell you, 7 year olds don't go for brushing on their own. You have to take them. So again, sometimes parents should not beat themselves up for all the issues and behaviors that they might see in their child. Don't try to oversee or list out things that might be a part of normal parenting and child, right? There are not there are some, but there will be huge amount of people around you who would tell you that my child is apparently okay otherwise, but he or she is also not getting up from the bed. He or she is also not going for brushing. Especially look at the age. If the age is 7, we are worrying too much about brushing because 7-year-olds don't do brushing on their own, right? And that is why I said that we need to understand child development in the functional activities also. At what age child does dressing by himself, clothes wearing? Because if I don't know, I might expect and report my 6-year-old does not dress himself, right? So I see that a lot of times it's not parents' fault. This is what awareness and knowledge creation requires. There has to be an understanding of these aspects to be able to not beat yourself up unnecessarily. Also, not stress on things that are going to happen in due course of time, but they will not happen at this age. Correct? Because that's not fair to anyone. That's not fair to the parent, and that's not fair to the child because it's over expectation and it's over stress to the parent. Now, definitely when I talk about, so this is one category of issues and my perspective on it. These issues of poking eyes or pinching are definitely something that come under the adaptive behavior. And adaptive behavior is definitely something that can be taken up at any age. So if your 3-year-old is poking in the eyes, it needs to be corrected. You can't accept it because then it will become a pattern, right? And if it is happening at 7, definitely it needs to be worked on, because again, at 7 also you're not supposed to poke on somebody's eyes. So one of the treatment or one of the solution that I can suggest you, again a little hypothetical, I say that hypothetical because as a clinician I'm supposed to evaluate a child objectively and only then give the recommendation. However, in a parent training program like this, we usually do offer them solutions which are apparently safe, which can be tried and tested, and parents can then take over an action of, okay, this did not work, I need to further assess the child, I need to take this child to offer this child for further assessment. I just wanted a clarity on this. So having said that, if somebody is poking in, if the child is poking in the eyes, what you need to first think of, what is your reaction? Because if your reaction is this, or if your reaction is no, then he's probably going to do it again and again because of attention. I'm not suggesting that he pokes in the eyes and you don't react anything. I'm not saying that, because it's not possible. It's a natural response for any human being to be uncomfortable with it, to avoid it, to get shocked with it, and also to hate it or also to reject it. It is very natural responses. But what we are supposed to do is think a little objectively. If he's doing this, maybe he's trying to seek pressure on the fingertip. And then what should we do? Very simple and straightforward. Give him pressure on the fingertip. Give him pressure. When he's doing this, just take the hand out, start pressing on the fingers. Hold the finger for some time. The child starts removing it. And if he removes it, you can release it, because you are doing it with the right intention. You are not punishing the child. Remember, you are not punishing the child. Punishment is unethical. When you are pressing, you are giving a feedback. You are not pressing to the extent of pain. You are not pressing to the extent of discomfort. But you are pressing with the intent of massage, with the intent of deep touch and pressure, with the intent of feedback to the fingertip. Now the child doesn't understand. He wants to take it off. You release it. He does it again. What you are supposed to do is simply repeat your action. Why are we repeating it? Because the child needs to condition the response, his action of poking the finger to press, to getting the deep touch as a connection. He needs to see that connection. You don't have to tell him verbally. When something as a physical action is done as a pattern repeatedly, the child gets it. He gets it that this is being done. Whenever I do this, finger touch. Whenever I do this, finger touch. So then next time he, over a period of time when he does this, he kind of remembers that if this finger goes to the eyes, some feedback comes to my finger also. I don't want that feedback to come to me because it is something unusual to my fingertip. One. Second, I realize that my fingertip stops working for some time. It stops working because it's very boringly being held in one position. Third, whenever I do this, instead of getting the soft touch of the eyeball, I actually end up not getting that sensation. So I'm withdrawing the sensation from your fingertip by saying that this is not available, but this is available. My touch is available. When I do that consistently, I would be able to see a pattern where the child kind of stops himself from doing it because he knows that he's going to get that finger touch and pressure. So on one side, you need to be a little more understanding of the parenting aspect, which is as per the child's age. On the other side, some sensory input can definitely be used on the fingertip. Yeah.
Thank you, sir. This is something really important that it's an alternative way of dealing with these situations. That if he really wants to pressure his finger, then and also you have mentioned about the reaction. Yeah, I from my own experience, I can see that my son does the repetition because I react to it. I react to his behavior, and then he does it. And but sometimes he also choose. He does it in front of people where I can't say anything to him. So he always find a place that now mommy can't say anything to me now, so I'm going to do it. So this is something so I have to find the alternative that, okay, now people are here. He knows mommy is not going to say anything to him, and he's going to find the way of trying to get my attention. That will annoying me, but it's like a playing games with me. But thank you, sir. This is so really, very much. I think the mom will be very happy that that she can try with her child. And also she did mention about that. This is, I think, it's quite safety issues. That he always trying to jump. He does. He kind of like climb, and especially he climbs on the balcony grill. So that's what he said, that he always climbing, and he doesn't know how to wait and for others to do something. And also his behavior, he exposed that he doesn't really care what other people are there, and he doesn't behave not appropriate. So for a 7-year-old child, it must be a little bit difficult for parents if the child doesn't really behave appropriate. But I think it's a kind of like common situation. I think it's a lot of parents like us. We do feel that our children really don't behave appropriately in front of people. And also, I've got another question from Siddika. Says, child is 3 years old, and she wanted to share this. So the child is 3 years old, and she doesn't keep any clothes in. She every time they will try to put the different clothes to him, the child, but the child will take it off. And also, so they have tried with the dress, trousers, and so she will take it off. She knows how to take it off. And also shoes. She tried that, and also they are trying with the different clothes, but still the child is not going to keep that. And also when but one thing child does, when child goes out, she does not mind, she will keep the clothes on. So this is something, she is very clever. And also I don't know how you're going to help this mom. I'm sorry, we don't have much time, but I have got few questions here the parents have provided earlier. So are you happy to carry on answering this, or would you like me to really quickly go to these questions so you can kind of like do it in one go?
I think we should go one by one, because I won't remember then. So let me finish one by one.
Yeah,
So
sure.
this child that you said about clothing, how old is this child?
Child is 3 years old.
3 years. So
Yeah.
with 3 years old children, you have to again manage it through what we call as handling. When we say handling, what do we mean by handling is it's the interaction of the parent and the child that needs to be worked on. I'm very sure that if a child is okay with going external, going outside with clothes, but not keeping it inside, is may not be a matter of sensory. Sensory, by definition, we say that sensory issues have to be present in at least two different environments. For example, home is one environment, park is one environment, mall is one environment, school is one environment, a restaurant is one environment. So there could be multiple environments that the child visits or goes to. One sensory issue should be present in at least two environments. Suppose flapping. Now the child does flapping at home also, and the child does flapping in the OT clinic also. So then we are saying that it is present in two environments. Now if we have a child who is only showing dressing issues in one environment but doesn't show it in other environment, it's a matter of handling. It's a matter of how can we ensure that the child keeps on accepts clothing. Maybe the child has made a game out of it. The more they will give me dressing, I will keep it taking it out. It has become a game for me. It has become fun for me because parents keep running after me for clothes. There can be a tactile component to it, but again, hypothetical. I would still say for a 3-year-old, you have to try what kind of textures are acceptable. I'm not saying that she should be accepting all the textures at 3-year-old, at 3 year of age, but you can work around what kind of textures is most likely to be accepted. Will she accept half sleeve or a full sleeve? If a child is taking out again and again, probably half sleeve and not full, so that the tactile component is a little reduced. Will she be okay with a denim or non-denim? Probably with non-denim, because denim obviously has a little more texture to it. Will she be okay wearing something that is short on the legs, like pants, shorts, whatever, half pants it might be, instead of a full pants? Then definitely we should try on the shorter versions of it. Yeah. So something and shirt that is snugly, that is a skin fitting kind of a shirt, like our thermals are, or something that is a little looser, on the loose side. And you'll have to work around it, because there are some children who like to be tightly fit into the clothes, and there are some children who like very very loose, extremely loose kind of clothes. So you can work around that. But apart from that, how you are making her wear the clothes and how you are reacting to her removing of the clothes is something that is we have worked with children who strip themselves. We have worked with children who strip in the OT, who strip in the classroom. And typically I have seen that it's all a matter of how tactfully the parent is able to manage it, and does not allow, without creating frustration, does not allow the clothes to be removed. With one child, we used the straps, the the elastic kind of straps, to ensure that she's not able to remove it. With one of them, we tried that if she knows how to do unbuttoning, maybe we give her something that does not have button. With one, we have tried that if she's comfortable with the loose one and she kind of removes it easily, how can I ensure that I hold her hands and start giving her pressure on the hands before she removes it rather than after. So, an important aspect of handling in this child, for a 3-year-old especially, is that the parent will have to work with a therapist to understand how does a therapist stop the child from removing clothes. The onus is on the therapist. The onus is not on the parent. Let the child go to a therapist, and I assume that the child, after going there, might also try to remove, but the therapist has to first demonstrate to the parent that if it happens in front of me, what is my reaction, verbal also, and what kind of physical actions do I use to ensure that the child does not get frustrated, but even then is not able to remove the clothes without forcing, without really using your physical force, but still. So the basic simple easy example is, if you are removing your clothes, you need your hands to be free. What if, when you take your clothes, when you're about to take your clothes out, or if you just connected with the cloth, I run to you and engage your hands in something. Maybe engage your hands in my hand. Maybe engage your hands in a ball. Maybe engage your hands in touching something nice. Maybe engage your hands in just holding your hands. Just holding your hands for some time. Because if my hand is engaged, how do I remove my clothes? I cannot. So the essential idea there would be, how do I engage the child's hands at that point of time? At that point of behavior, I need to engage the child's hands somehow or the other, and should not be difficult for a 3-year-old. Children can be very tricky, they can be very fast, and they can be removing clothes just in a flash of a second. However, as a grown up cognitive adults, we will have to be more tactful, more faster than they are, and we'll have to work around that behavior. Yeah. So I would say it's a matter of handling, which the parent will have to learn here. It has less for the sensory aspect, more for the handling aspect.
Thank you, Dr. Samnani. I'm going to just quickly say this. Mom is Aliza Rahman, if she is there. Her child is 5 years old, is a boy, and with the ASD, and he can't speak. He's a non-verbal child, and also what he has said, mom has said that he is on his feet whole day. Any clothes is like putting on the chairs or the bed or on the table. What he will do, he'll put them on the floor. So it's a kind of like a game to him. And so also she has a very difficult with this child is she every 5 minutes he wet his trouser. So he goes to the toilet, but he doesn't do it properly. But when he comes out, so he will do it each like every 5 minutes. So it's getting a little bit difficult for the mom to change this trouser every 5 minutes, because 5 years old child. So is there any reason this child is not passing the urine in why he's not passing the urine like in one time, why he's kind of like keeping that in, or does he have any physical problems so he can't hold, or is it kind of like related to his bladder? He has got the bladder issue.
So there are two things again. One is, of course, about the bladder issue or a urinary tract infection, which needs to be ruled out, screened out by a medical professional.
Yeah.
The therapist, I can't comment on that. But another aspect of wetting the clothes again and again, we have worked with children who have that, and we have seen that sometimes children do it behaviorally as well. What that means is they kind of escape. When you start working with them, they will wet themselves up deliberately,
Okay.
and then you take them up, then you kind of change it, and they again wet themselves up. I have seen this happening not with a 5-year-old, although with a little older child to happen, and it's very strange to understand how they can do it. how they can do it at will, but that's how tricky sometimes autism condition is, that they are able to do certain things that are beyond any understanding, and they are not able to do something which is very basic and simple like talking. So if I assume that there is no medical urine UTI bladder issues, which I of course will not be able to comment on, the other aspect, behavioral aspect, has to be dealt with lot of patience and consistency. What I want to say is that if you lose your control, if you get frustrated and upset, then it might be counterproductive. What can happen is, uh, and I know this from a parent's experience, that this child was not very comfortable in being put in diapers. So the mom told the child, if you wet your pants, you will have to wear a diaper. She told verbally, or maybe showed him, or maybe did it one time to give him a message, or again a feedback. It's not a punishment. It's a feedback that, look, if you wet yourself up, I'm going to do this. And giving you this solution for a 5-year-old, assuming he does not like diapers. There can be children who are happy being in a diaper, and we don't want to. So in that child, if he does not like, if he is not minding a diaper, he's okay with it, then you'll have to work around with patience and consistency. Meaning thereby, whenever he wets his pants, you'll have to make him work a little. For example, let's go to the washroom. Now, you don't take him to the washroom and change his pants as a passive method. Passive means child will not do anything, everything mother has to do. Don't do that. You will accompany the child, but give him lot of instructions to change the pants. Give him lot of instructions to pack the wet pant in some polythene or packet or whatever you have. Give him lot of instructions to pull out the fresh pant and ask him to wear by himself. What I'm saying is, it's a natural steps of the task, isn't it? These are natural steps. But be mindful of making the child do it by himself rather than parent doing it. Even if it takes more time, even if it takes more time than changing the pants, ensure that the child does it. Ensure it. Okay, you do it. Okay, now you put one leg in it. Okay, now you pick up the wet pants. Okay, now you put it in the bucket, or your laundry basket, or whatever. Whatever are the natural steps that the adult was supposed to do, make sure that the mother is insisting on the child to do by himself, however young he might be. The message, the feedback, the input that we want to give by this is that if you are wetting yourself up, you will be ending up doing a life skill chore again and again. You will lose out on the fun that was outside, or you will lose out on the activity that was outside. But remember, it's not that you will not be doing anything because you did it for escaping. It's not that you will not be doing anything. In fact, you might be doing more work, more physical work, more instruction are coming to you whenever you are coming to the washroom. It does not happen in one session. It does not happen in one attempt. You'll have to have the patience and keep doing it. Make the child do it in a non-strict way. Don't scold the child. Don't scream on the child. Don't make him tell him like as if he's paying a price or he's facing some consequences. It should not come as consequences from you. This is his mind should tell him, I have come 5 times already. 5 times I had to remove my pants myself. 5 times I had to wear my pants myself. 5 times I had to wipe myself with a tissue. 5 times I had to put my own pants in my basket or bucket or whatever. And then I am again sent back to the work. So I think it's not working out for me. This is a message that we want to give the child's brain. It's not working out for me. It's way too draining for me. And then he corrects himself. This I am assuming only if the medical issues are taken care.
Um, Thank you, Dr. Samnani. What I have experienced from my son that he used to, because he was so hyper, and he's come down a little bit now, but he used to be very hyper, and he didn't want to sit on the toilet for a long time, so he was rushing. So his mind was like wandering, and then he did not finish it. Even so I had to make sure that he sat there and he fully empty his bladder, and then I'll let him come out from the toilet, because I've realized that's the only way it worked. That he has to sit down on the toilet for a long time until he is, fully, empty bladder. Otherwise, I know that I had the same problem, that he used to go to toilet every 5-10 minutes, because he still wasn't like happy. He still had that feelings. Thank you so much. I think it will help the parents, that if, like what Dr. Samnani is saying, that you are kind of like doing the two things. You are trying to teach your child to be independent at the same time, and also it's like a then that's the way. If child knows, then if I do that, and I have the consequence, and he's learning the skills, but at the same time he's understanding that my behavior is making me to do that. So viewers, আপনারা প্যারেন্টস, আপনারা যারা আছেন আজকে, যারা দেখছেন এই শোটা, আমার মনে হচ্ছে যে অনেক কিছু হেল্প করবে। I'm just only going to ask one more question. I know that time is running, and I do apologize. You had a session before us. Must be really tiring for you. But I think this is quite important, because I have experienced that, and I'm sure that there's many parents are probably going through the same phase. So this child is 13 years old, and what she does is she tears papers. She will, like books or notebook or anything or newspaper, she will tear them. And also what she has done, this is very much interesting. I found that. So because the book is covered with the plastic, the covered, the top page, and she will get it and take it off from the book, and then she will put it in the water. She will soak that plastic, that cover, and then she will take the plastic things out from that water. Once the paper, it gets shrinked and it gets soaked, and then she will slowly take the plastic things out from these papers, and then she will roll them. So I found that quite really interesting, that why she does that. So how does she know? She's so clever. She's 13 years old child, but she has realized that plastic does not soak. It's only the paper will be, and she can separate by doing that. So, but mommy, because the parents are, it's because she does it with everything. She does it with everything, even their important papers. They can't hide them. She will tears them. So, do you think how can you help these parents? What the parents should be really doing it, and how she can stop doing it?
Sure. So I'm sure what you are also appreciating and saying is correct, that this child has an amazing sense of logic, a little bit of science. What soaks, what doesn't soak is a science, and also motor planning. Amazing sense of motor planning. But I wonder that this child might be doing these things for self-engagement, for engaging yourself. Now, remember that a child is supposed to learn self-engagement. It doesn't come to a lot of children naturally. What do I mean by self-engagement is that time and those activities which are not under an instruction, which are not directed by you. The child is having a free time. Now, what happens in free time is child's business on one side. However, a lot of children, in fact, a lot of so-called neurotypical regular children also do not know what to do in their free time. They do not know. What happens is that with regular children, we give them options of a mobile phone, a tablet, a TV, a game, or indoor game, or whatever. But when it comes to children with developmental delays, difficulties, and autism, we tend to kind of forget that. We assume that the structure time, therapy time, special education time is the time that we have to focus on, and the rest of the time is his own. I mean, he's free to do whatever he wants to do. Now, what happens with that approach is that sometimes children do gravitate towards their own ideas, which can be channelized, acknowledged, and taken further. However, if we are not considering them important or we are not focusing on them, they might just pick up something of their own. I remember a child who used to get visual by tearing a paper, putting it over a pen, and then holding it under the fan so that it goes round and he gets the visual. Now, it's amazing because nobody taught him how to make that. So he did apply science, he did apply aerodynamics, he did apply motor planning to be able to get that. Having said that, we have, for this child, we have to direct her mind in her not so free time in similar activity but a little more meaningful. For example, what is the meaningful activity that you can do by soaking in? Because the child is already soaking in. But I know we have to teach her what can be soaked in, what cannot be soaked in is different, but what can be soaked in? Is it available to the child? For example, if I want to make a collage, if I want to make a handmade paper, if I want to do an art and craft that does require soaking in, and there are, I may not be an art expert, but I know for sure that there are a lot of art and craft based activities that require soaking in. But what do you soak in is specific. You can't soak in currency notes, for example. You cannot pull out important file of your parents and soak them. But what if we haven't given them another file, separate file that does have material that can be soaked in? Old newspapers, papers that are not useful to you, old covers of the books. Because we are seeing the child's inclination and interest towards it, we'll have to collect those materials mindfully, put them in a box or a bag or a folder which is easily accessible to the child. First, whenever the child is soaking in XYZ, you remove the XYZ and offer this folder or box or bag to the child, just to tell the child, it's okay you are doing that, but I want you to use these materials. Don't talk about what you don't want to use, talk about what you want them to use, which you have collected mindfully, which you know she will like it, and also they are not useful to you. You can't tell a child, now that you are soaking in, go into that room, climb up that cupboard, there is an old book, pull out the cover, that is okay for you. You can't do that, because that requires an enormous amount of work and processing, which the child may not like doing. You will have to arrange for the child. You will have to be proactive, arrange it in a little box, a kit for him, which will be presented to the child whenever the child is free, whenever the child does not know how to self-engage herself. This kit is an art and craft kit that involves soaking in. There are art and craft kits which involve plaster of Paris. Now, plaster of Paris also you have to soak in and then apply somewhere. All those kind of activities should be available to the child, initially taught to the child in the structure time, suppose special education time, therapy time, or whatever teaching time that the parent has. Introduce those activities in those times, and then make them available to the child in the free time. What that means is, I want to superimpose activity that she's already doing with material useful to others with material that is not useful to others, and then the activity itself becomes acceptable. It also has to have an end product. You can't say soak in and take out the plastic only, but can it be developed into a proper art and craft task, which it can be. So, but there will be a graded teaching to it. You'll have to introduce the child that activity in the structure time and give it to her in the free time. Don't let the child's free time or self-engagement time be their own business. The ideas have to come from you. If you have practiced 1 or 2 times in the structure time, then the child does it in the free time as an idea. If the child does not have any ideas, then she picks up her own ideas only, which is happening in this case.
Thank you, Dr. Samnani. It's a really good explanation. I'm hoping that Mom, if she's watching us today, and it will really help her, that what Dr. Samnani is saying, that মানে এটা আসলে সে নিজেকে এঙ্গেজ করে রাখার জন্য একটা সে মানে বের করেছে খেলাটা। সো আপনাদেরকে আসলে একটা অল্টারনেটিভ কিছু বের করে দিতে হবে যে ও কন্টিনিউ করবে, বাট যেন ওকে একটা বাউন্ডারিজ দিতে হবে যে এই জিনিসগুলো সে শোক করবে, বাট এই জিনিসগুলো ইম্পর্টেন্স যে ওটা শো করবে না। আসলে আমরা কিন্তু অনেক সময় দেখেছি যে আমাদের বাচ্চাগুলো নিজেরা আসলে অনেক কিছু আমরা মানে অন্য নর্মাল বাচ্চাদের মতো ওরা কিন্তু অনেক কিছু ইমেজিন করে, অনেক কিছু ক্রিয়েশন করেছে, রিয়েলি মানে ও সামথিং নিজেই কিন্তু খুঁজে বের করেছে। তো এই জিনিসগুলো হচ্ছে যে অ্যাজ এ প্যারেন্টস আপনি কি খুঁজে বের করতে হবে যে কোনটা অল্টারনেটিভ। আপনি কিন্তু ওকে সম্পূর্ণ স্টপ করবেন না, বাট ও কেন এই জিনিসটা করছে, নিজেকে এঙ্গেজ করার জন্য, কিছু বের করার জন্য, খুঁজে বের করার জন্য। সো আপনি অ্যাজ এ প্যারেন্টস আপনারা যদি একটু বাচ্চাটাকে একটা অল্টারনেটিভ কিছু দেন যে ওই শোক করেই যে কি করে ও মানে করবে, যেটা আপনাদের কোনো অসুবিধা হচ্ছে না আর কি। Thank you, sir. And also, I do apologize for taking longer. We supposed to finish at 1:30, like 1.5 hours show. But as you know that parents are, we have got so many parents. We have got so many parents watch this show, and I've been advertising for quite a long time because I think the occupational therapy, this therapy session is so important. It is so important, and also the people, parents, the people who are not really understanding the sensory issues, and they get really frustrated when the parents can't help the children. They get frustrated, and when children don't get the same, like good response from the parents, children get frustrated, and it gets really hard for them to live together, because we have to know how to help this child. Thanks again, and it was such a good session, and I'm hoping the viewers and the moms and the parents, they will be really benefit from this show today. And again, Dr. Samnani, I don't know how to really say thank you to you. Thank you is a really small word. You have done such a wonderful job by coming here and giving us this time. I'm hoping that we can see you again here at Maralingan, because this show is for parents like us. There's so many people are not able to get the proper therapy. As you know that therapy is getting quite hard, because they can't choose. They can't choose. The parents are being misguided, and they really can't choose what correct therapy is really suitable for their children. So, but are you happy for me if the parents asking me that how can they contact you? I don't know how. I kind of like tell them and advise them, and kind of like I don't know how to really link to them. Do you have any like a numbers or anything that parent can message you directly?
Yeah, yes, of course. Yes, of course they can. They can use my email ID. They can use phone number as well. Absolutely not an issue.
Thank you so much. You can see this is called is a like a what is a good human being, that he's really using his assets to helping us. Thank you so much, Dr. Samnani. We had so many questions from the viewers, but unfortunately because of the time we are not able to take any questions and answer. But next time inshallah we will going to ask Dr. Samnani you will be the first people. You will be the first people whoever is not able to answer the question today. You will be the first people to choose. And thanks again, Dr. Samnani. And he has just now kindly left his number to us. And if viewers, if you need any kind of help, regarding to the sensory issues and the therapist and the occupational therapist, please come to the Maralingon. And of course, we're going to, with his permissions, we are going to give the number to you. আপনারা দেখতে পাচ্ছেন ভিউয়ার্স, আমি খুবই সরি আর কোনো কোশ্চেন নিতে পারছি না, বাট থ্যাংক ইউ সো মাচ ফর স্টেইং উইথ আস। All the viewers, you've been such a fantastic, and you can see Dr. Samnani, they were really asking, and but please do come again. It will be really great honor to.
Absolutely, I would be happy to be there on the platform, and thank you so much as well for organizing it so beautifully. You have been able to compile the questions in such a way that it brought about a lot of multiple facets rather than only sensory. I can see that the kind of questions that were put together brought out a lot of good things or different aspects, not just sensory but behavior, handling, and other aspects, which is truly the matter of the fact that it can't be only sensory. It has to do with so many things taken together. So I really appreciate your way of taking it forward, organizing, and also putting it forward to me as questions.
Thank you. And on behalf of Maralingon, I just want to say thank you again and showing our appreciation that you came here from and given us the time and your effort. And viewers, we have got, the shows, we have got another show next week with another sessions. And but until then, we have to let Dr. Samnani go because it's been a really long day for him. And I just attended one of his session just before he started this live show. So, and that session was really wonderful. And the parents, if you think it will benefit you, and I'm sure that Dr. Samnani is going to organize more session like that. What we are attending at the moment, please do contact the DWISH, and please do contact Dr. Samnani directly. One thing I know, the parents has to be educated. The parents need to know how to handle the child. So thank you again. Please do stay with us. We'll be seeing you soon. Take care. Have a good evening.
Thank you so much.